Hutchison. I am a group member of Team 3 along with Hun Lee and Miguel Rodriguez Jr. We will be conducting our presentation on EHR, or electronic health records. To begin our presentation, we can take a look at our table of contents. Here we can see that we will begin with an introduction, which will answer questions such as what is EHR and what is the difference between EMR and PHR, as well as discussing the federal mandate, the integration nightmare, some issues and concerns, the pros and cons, and how to mitigate. Following our introduction, we begin our research portion of the presentation, which includes general research of EHR, the cost of using EHR, the meaning behind its use, and how EHR compares with paper records. After discussing the research behind the electronic health records, we will discuss the implication of the technology. This will include qualified EHR, the capacity of qualified EHR, EHR module and examples, complete EHR, and certified EHR technology. To sum up our presentation, we will read our conclusion. What is EHR? EHR, or electronic health records, are a systematic collection of electronic health information about individual patients or population. These records are in digital format that is theoretically capable of being shared across different healthcare settings. What is the difference between EMR and PHR? EMR, or electronic medical records, are created by hospitals and ambulatory environments, whereas PHR, or personal health records, are records that a patient controls. Both of these serve as data sources for EHR software systems designed for use by healthcare providers. Federal mandate. By 2014, all medical records in the United States will be required to be converted into the electronic format. The American Recovery and Reinvestment Act, known simply as ARRA, was enacted to move on to the electronic platform of storing patient medical records. The federal mandate serves for physicians who either have not adopted certified EHR or EMR systems or cannot demonstrate meaningful use by the EMR deadline in 2015. The integration nightmare. The note data is not discrete like medications and problems. It is a complex document stored in a format known as XML. XML is a structured language. The document is first through the note in the database. You would first have to decompress the note and then scan through the entire document for an identifier that is specific to that note. As you may expect after just hearing about this, it is a nightmare for any type of reporting. Some issues and concerns. One main issue involves privacy and legal problems. Related to this is the issue of medical data breach, which is regarding compromised confidential health information. All these types of issues are reduced to the concerns over the possible threat that personal information could be accessed without permission, such as by unauthorized employees or hackers. In this age of technology, people have trained themselves to be very skilled at hacking into computer database systems, and it can be a very real concern. Another concern is the threat of natural or environmental disasters such as earthquakes, hurricanes, and fires, which would not allow access to these records. Generally, in the event of these types of disasters, there are power outages that can oftentimes be major and last for hours or even days at a time. Unfortunately, this is also usually a time when many people need medical attention and may need access to their medical records and history. Lastly, a concern involving EHR is the possibility of technological failures, such as the system crashing, which could cause a loss of information. Pros and cons. One of the pros is that in an emergency situation, the hospital can access a patient's information easily, even if the patient is incapacitated. Another pro is the ease of long-term preservation and storage of records. Using an electronic database is much easier to organize these records rather than keeping track of many paper records over a lifetime. Some of the cons that we touched upon earlier while discussing the issues and concerns are that all individual medical information can be lost by natural and environmental threats, technology failures, and that virtually everyone can gain access to other patients' information. How can we mitigate the risks? First, healthcare providers can give different IDs and passwords to each employee, and secondly, they can provide EHR education every month. Some research regarding EHR. Electronic health records are basically digital versions of a patient's paper charts that make information available whenever and wherever they are needed. They contain information about a patient's medical history and also offer access to evidence-based tools that providers can use to make decisions about a patient's care. Some examples of how EHR assists healthcare providers are in diagnosing some patients, prescribing medications, checking immunization dates, accessing radiology images, being aware of a patient's allergies, and saving lab results. EHRs are pretty expensive to start up and maintain, but they increase organization and accuracy of patient information and care. Cost of EHR. More than $4.4 billion in EHR incentive payments have been paid to 76,000 plus healthcare providers as of March 2012. Physicians must be able to demonstrate meaningful use. The meaningful use standard is measured in stages. Stage 1 started in 2011 and ended in 2012. It required that providers meet 14 to 15 core requirements and choose 5 more from a menu of 10 options. Physicians will have until the end of 2014 to meet Stage 2. Startup cost. An average American Academy of Family Physicians user is reimbursed 20% by Medicare. A private practice with $500,000 of annual income that fails to meet the electronic medical records mandate will lose $1,000 in payment in 2015, $20,000 in 2016, and so on. Cost of maintenance. The average estimated maintenance cost is $8,500 a year per full-time equivalent healthcare provider. Training cost. Training of employees to use an EHR system is costly, just as for training in the use of any other hospital system. New employees, permanent or temporary, will also require training as they are hired. The main components of meaningful use are the use of a certified EHR in a meaningful manner, such as e-prescribing, the use of certified EHR technology for electronic exchange of health information to improve quality of healthcare, and the use of certified EHR technology to submit clinical quality and other measures. The meaningful use of EHRs intended by the U.S. government incentives is to improve healthcare coordination, to reduce healthcare disparities, to engage patients and their families, to improve population and public health, and to ensure adequate privacy and security. Electronic health records versus paper records. Organization. Paper records are often incomplete with unnecessary repeat testing, while electronic health records provide a complete report. Electronic health records are easy to generate reports. New providers must take the time to retrieve patients' records from multiple offices with paper records, whereas with electronic health records they are readily available. Sharing records. Paper record systems can make it difficult to put together a complete history of a patient's medical history due to records being transferred by mail or fax. Electronic health records provide access to complete medical information about a patient, so the office can skip the retrieval and faxing process altogether. Accessibility. Electronic health records are available 24 hours a day, 7 days a week. Records are available with the help of internet connection or a mobile device. On the other hand, paper records accessibility is limited due to location and office hours. Qualified electronic health records are electronic records of health-related information on an individual that includes patient demographic and clinical health information, such as medical history and problem lists. Capacity of qualified EHR includes providing clinical decision support, supporting physician order entry, capturing information relevant to healthcare and quality, and exchanging electronic health information with and integrating such information from other sources. EHR module includes any service, component, or combination thereof that can meet the requirements of at least one certification criterion adopted by the Secretary. Some examples of this are an interface or other software program that provides the capability to exchange electronic health information, an open source software program that enables individuals online access to certain health information maintained by EHR technology, and a quality measure reporting service or software program. Two more examples of EHR modules would be a clinical decision support rules engine and a software program used to submit public health information to public health authorities. Complete EHR encompasses EHR technology that can perform all of the applicable capabilities required by certification criteria adopted by the Secretary and distinguish it from EHR technology that cannot perform those capabilities. Therefore, complete EHR is expected to have capabilities beyond those addressed by certification criteria adopted by the Secretary. Certified EHR technology would be complete EHR or a combination of EHR modules, each of which would meet the requirements of qualified EHR and has been tested and certified in accordance with the certification program established by the National Coordinator as having met all applicable certification criteria adopted by the Secretary. To conclude our presentation, we can take a look back on what we learned. An EHR, or electronic health record, is a digitally formatted systematic collection of electronic health information about individual patients or population and is theoretically capable of being shared across different healthcare settings, and starting in 2014, it'll be federally mandated for all medical records to be electronically formatted. These systems are expensive to start up, and as of March 2012, more than $4.4 billion in EHR incentive payments have been paid to over 76,000 healthcare providers. Healthcare providers also have to consider the cost of training and maintenance. We also learned some of the concerns involving electronic health records. A main issue concerning EHR technology is that it may be a breach in privacy for patients and that important private medical information could be hacked into by a third party. On the other hand, EHR technology allows hospitals to access patient information in case of an emergency and can easily show a patient's full medical history. Usage of EHR systems help doctors diagnose medical issues and prescribe the proper medications based on allergies and medical history. EHR is overall easier to organize, share, and access records than with paper records.